It was a very localized type of a pain, right around my eye and bridge of my nose.
And it was something I've never experienced in my life as far as pain was concerned.
I did not know what it was. I felt that it was, I needed a root canal or something with my tooth.
It's actually unusual for patients at the first onset of their pain to have the correct diagnosis. Often it's a difficult diagnosis at the early stages because the pain is not that bad. A lot of it can be mistaken for pain coming from the teeth.
Terrific pain, almost like a twinge.
It started out really just with the touch of maybe the temple area or the hairline here, and the pain would shoot up into my brain. It took my life away from me, really. The quality of life wasn't there anymore.
As an aspiring coach for youth hockey, I had difficult moments regarding the instruction of the kids, and when I attempted to help out a team, going to the head coach to ask if I could be a volunteer, I would have an episode and wondered if that hurt my chances to help out because I couldn't communicate properly.
Initially there's a response to Tegretol, and then the response tapers off and the dosages required become higher and higher to the point where side effects occur.
He started me on Starvicet, maybe something like that, and hydrocodone. The hydrocodone I didn't agree with me, so he switched me to oxycodone and eventually Tegretol, a low dosage. I believe it was probably 100 or 200 milligrams a day.
This is why he switched me from Neurontin to Tegretol, because of the spell I had.
And then they put me on some medication, which was Tegretol, and that helped a little bit at the beginning, but you have to keep taking more and more of it. You start off at 100, and then it would be okay, and then it would get worse and worse.
When I took the medication for trigeminal neuralgia, I had experienced varying symptoms.
So irritating. I didn't want to go through life taking medicines that weren't really doing it.
Other procedures that are effective in relieving the pain of trigeminal neuralgia are nerve destructive operations that try to destroy some of the pain fibers in the nerve. The unfortunate aspect of those procedures is that they often leave patients with a numb face.
What it involved was inserting a needle in the base of the nerve, and this made the nerve numb along with the face, and but he said this would disappear, the numbness.
And when I came to see Dr. Lewis, he explained some of the remedies, and one of them was the gamma knife, and that was the one that I was the most interested in. It sounded like it would be the least invasive, but Dr. Lewis did not recommend that because there could be some, I believe that you would have nerve problems, or you could have nerve problems with that.
My son-in-law, Dennis, did receive a copy of your pamphlet, the 3-page hard copy pamphlet that you wrote, from a colleague of his, and he gave it to me, and she suggested I really consider this seriously. He said the percentage of success was quite high, 90 to 95%, and he recommended I go ahead and do it.
And there were a couple different treatments that were known, and ultimately, the brain surgery was the last step considered by the profession, but ultimately it is the best step in my opinion.